I want to bring our athletes into this and maybe ask you, an athlete, what will they feel? Because, I mean, it might be something like when they're in menopause, it's not the test, but what that you always feel as an athlete, what will they feel? How does it look in an athlete's mind or in their body? What will they feel in the day?
So there's a really nice study where they looked at iron deficiency and the symptoms of iron deficiency. This study was done specifically in women, but it is the most recent data that we've got. So almost 100% of people with iron deficiency, and that's non-anemic iron deficiency, have got fatigue. So, and how that will manifest in the athlete is, they're just not performing quite the way that they wanted to perform. They are tired. And a lot of people will say they've just sort of got mummy brain, or they're just a bit foggy. These are symptoms of iron deficiency, shortness of breath, not reaching my optimal VO2 max, even as an athlete. But other people are really just much softer symptoms. They might be anxious, they might be depressed, they might be sad, not motivated for this very sport that they love. And they've lost their love for the sport, which for me would be the biggest loss of all, is to see somebody lose their sport. So the neurocognitive functions of iron deficiency absolutely cannot be overstated. And I think in a sportsman where your big match temperament and, getting yourself ready is really big. So that's another place. But then, your skin can become dry, you might bruise easily. There's lots and lots and lots of things that long before, and you'll notice that I never use the word pale. So nobody's going to say, well, this person's looking a bit pale. Yes, they will become pale. But long before that, the patient will have other complaints, which are much softer complaints that people might say, oh, we'll take a Serdep, just rest a bit. You haven't rested enough. You're overtraining.
I also think that when people look at athletes, they think, oh, but they've got their diet dialed in. They should be fine. But obviously, there's other reasons why they might be low. I mean, they've probably got a higher need of iron than the general population as well, and lose more than the general population.
So yes, athletes generally follow a really good diet. So I know that some of the people that are listening are athletes themselves, and I'm going to try and explain hepcidin to a general population. But so yes, in good health, we absorb about 1 milligram of iron. So if we eat enough iron, we will absorb sufficient iron. Now, the paradox with being an athlete is that there's this hormone called hepcidin that gets released when your body is stressed. Now, being an endurance athlete, while being, something that makes all your friends very impressed with you, puts your body under stress. So now your body will release more hepcidin. And what hepcidin does, it blocks your iron absorption, which is counterproductive, isn't it? So now, because I have got this low-grade inflammation from having my big run or whatever sport it is that I was doing, now the release of hepcidin, no matter how much good iron I'm eating, no matter how much, whether I'm taking an iron supplement, yes or no, I've blocked the absorption of that iron. And that's one of the biggest reasons why athletes become iron deficient. It's not because they're not eating properly. Yes, they don't. A lot of them don't eat properly, especially in weight-sensitive sports, like ballet dancers, gymnasts, that sort of weight-sensitive sports. They don't eat nicely because of they need to not eat too much. But athletes also do lose blood. If you think of an endurance athlete, a lot of them get small bleeds in the gastrointestinal tract, often because of anti-inflammatories that they take, or just because they were running, and that by itself causes little bleeds. They get what in the olden days they used to call it March hemolysis, which from marching, from soldiers banging their feet on the ground, but it's very much the same in a comrades athlete. They get, it's now called foot strike hemolysis. So, you bump your feet on the tar long enough, you're crushing your little red blood cells there. So yes, it's a whole spectrum of why do we get iron deficiency. So even in the face of plenty, I can become iron deficient.